Medical doctor Dr Chris Reynolds responds to questions about the therapeutic benefits of wheatgrass. Does wheatgrass extract work for Molluscum contagiosum? Our doctor said it would take 2 years for it to go away.
Well, I used to say that to my patients before I came across wheatgrass, and in fact that was the standard, and still is, the standard response to molluscum. There's nothing we can use that's really safe for your child. There are fairly strong drugs out there that you can use which are cytotoxic. They're used for killing cancer cells and things, but it's not the sort of thing you want to be putting on an infant's skin or a child's skin, or an adult's for that matter, unless you absolutely have to. I'd been using the wheatgrass for probably a month or so, and one of my sons, he was about 5 or 6, he came home with molluscum. And molluscum is extremely common in the sense that it mainly affects young children at preschool, kindergarten, and it spreads like wildfire, and many children have it and nobody knows about it because their parents cover it up because it's a rather nasty looking thing. But what most people don't seem to realise is it's really quite a benign condition. That's one reason doctors don't get too upset about it. But the other reason is they've got nothing to treat it with. I remember my son, I mentioned before, he came home with it, and I looked at him and I thought, 2 years. That's what I've always said. And I said to my wife, I said, you would try putting some of that wheatgrass cream on it. You know, I said, it's not going to work, but you know, let's just see what happens. And I sort of forgot about it completely, and it was probably about a month later I had a look at his skin. I just checked it out and they'd all gone. I couldn't believe it. Just, you know, and that's where I started using it for molluscum. And I've had a lot of success ever since. And again, it's very, very safe. You know, you just apply a bit of the extract, you know, probably a couple of times a day. There's no strict dosage, but that's a rule of thumb, I suppose. And persevere with it. And since then, I've had so many reports from all around the world of it working for people, and there are testimonials on our website that are quite outstanding. I think they speak for themselves. So it may not work in every patient, but nothing does. But it's safe and it's worth giving it a try. And when you've got a kid with this condition, I mean, you really, I mean, you can understand parents getting upset about it because it looks so horrible, and there's spots and all over them, and they get pussy and they get red and raw, and you know, people, you know, it's sort of, they keep them out of the swimming pool. Some swimming pools won't allow children in the pool with molluscum, which I suppose is understandable. But the important thing to remember with molluscum is to leave them alone. Yeah, I mean, treat them like with a wheatgrass, but you know, don't puncture them or squeeze them or do. The condition doesn't scar. It doesn't cause scarring. You just leave them alone. They will get better ultimately anyway. But if you start fiddling around, slashing and burning and things like some doctors do, like this doctor used to do, and you know, you can cause scarring, and you can introduce bacterial infection, or you know, so it's not a wise thing to do. But then you've got the worried parent, and you know, it's very difficult for the doctor, believe me, to when you turn around and you say you've got this horrible looking rash, and sorry, but I can't do anything about it. But now they can.